looks so much better.
Yes, 1,000
Doesn't
times
he?
better.
When children are sick or injured, parents want the best, fastest treatment from caring professionals. At North Central Baptist Hospital, our pediatric emergency department, called Baptist Kids Care, is ready 24 hours a day, 7 days a week to help patients from birth through high school.
You have skilled people to take care of children. They've dedicated their training, their lives, and their care just for children. Say,
Dr. Tom Gowan is a board-certified pediatric emergency specialist
Good.
and medical director for the North Central PDED.
Any pain there?
He and his staff see 20,000 babies, children, and teenagers each year in this 16-bed department. We've been the leader in pediatric emergency services for almost 20 years in the Stone Oak community. The uniquely qualified professionals know how to treat everything from respiratory problems to traumatic injuries.
I think it's pretty important that you don't have to reinvent the wheel. We know how to staff appropriately, we know the level of care that is needed, and we know what patients need certain specialists, and we have good contacts and hardwired their references and consultations.
5-year-old Cameron Salazar benefited from fast-thinking emergency care after a bout of the flu triggered his seizure disorder.
We will always come here.
The family lives in Stone Oak and relies on North Central in times of medical crisis.
We live, thankfully, quite close to here, and so we make it here pretty quickly when he's had these problems in the past.
Okay, this is right when you hooked him up, though, at the very beginning, correct?
After Cameron arrived by ambulance, a neurology tech was able to capture his seizure on an EEG, which showed a storm of activity.
Let's see him after he got the anticonvulsants, what it looked like.
Rescue medicines got the problem under control, and he was admitted for acute care close to home.
Without a question, we would absolutely prefer to come to a place that has a dedicated pediatric emergency room and inpatient care. It's been a blessing for sure.
If your child requires admission, we have a pediatric ICU and pediatric floor. As such, your child won't have to be transferred to another facility across town and can remain right here close to home.
We're just waiting on the lab work to come back.
Pediatric nurses are experienced at delivering medications, starting IVs, and dealing with the stress that sometimes comes along with a child's visit to the emergency department. Large private rooms accommodate the whole family. North Central Baptist also has pediatric orthopedic specialists available, pediatric surgeons, and dedicated pediatric anesthesiologists. The hospital offers free close parking, making the facility convenient and accessible.
The baby is about 2.5 kilos. He's 35 weeks.
Plus, North Central Baptist employs a specialized transport team. That team can bring patients to the hospital by helicopter or ambulance. When your child needs an ER, think North Central Baptist Hospital and Baptist Kids Care.
He's got a fast-beating heart.
Convenient, experienced pediatric emergency care whenever you need it. That's the difference. That's Baptist Care. For more information, log on to northcentralbaptist.com. For the Baptist Health News Network, I'm Wendy Rigby.